Casey said, welcome to all who are joining us. We're really, really happy you're here. This event is going to be fantastic. I can't wait to climb into bed afterwards with my perfect skin and very ready for sound sleep. So again, welcome. My name is Nicole Warschauer. I'm the head of community over at Trusted Health. If you're not familiar, Trusted is the place for the modern nurse. We place trusted nurses, who are you, in travel assignments all across the country. And we also have a plethora of career resources for you, whether it's blog articles, podcasts, interviews, and obviously a virtual community just like this. And this week we partnered with the amazing folks at Outdoor Voices for Nurses First, the wellness series, which you're participating in right now. And it's been an amazing week of virtual events. We've done meditation, we've done Zumba, we've learned how to thrive through self-care. We've made snacks with Joy Bauer. It's been a really incredible week, and this is the capstone of the week, and we're really happy that you're here. And if you're not familiar with Outdoor Voices, they are an activewear brand based in Austin, Texas, on a mission to get the world moving by doing things. And they believe that moving is winning, and endorphins make you happy. You can check them out more at outdoorvoices.com or on Instagram at Outdoor Voices. So again, it's been a great week, and we're really happy to finish it off with some sound sleep and skincare. And so without further ado, I will share my screen and we can get to our main event, which is our Renée Rouleau as well as Lois James. So Renee's going to start us off, and here we go. Sharing. Y'all see my screen? Okay. Hang tight for 1 second. There we go. All right, so quick word of what's going to happen. If you have any questions throughout the presentation, please ask them in Zoom, and Casey, our amazing community associate, will answer them for you, or she will filter them up to one of the speakers. The second item is listen, learn, and connect. This is a great way for you to get some new knowledge, and then obviously craft a bedtime routine of your dreams. And the agenda, we kind of talked through this already, but we're going to talk about skincare with Renee and some questions with Renee, and then we'll talk about sound sleep with Lois, questions with Lois, and then we'll close it out. And I hand it off to Renee now.
Perfect. Hi, everyone. Thanks so much for inviting me to this, and thank you to all the good service providers out there, healthcare workers that do such a great job day in and day out. A little shout out to Outdoor Voices. I mean, you can't really see it, but I am wearing one of their shirts. I was a loyal fan of another athleisure wear line that starts with an L, and I used them for years, and I recently switched to Outdoor Voices, and I am a huge fan. I'm like, how did I miss these clothes? So anyway, so my name is Renée Rouleau, and I am an esthetician, and I own my own skincare company. I live in Austin, Texas. I've had my company for the last 24 years. And we sell skincare products direct to consumer from reneerouleau.com. Yeah, so I'm a trusted skincare expert, all things getting your skin clear, glowing, and learning to love the skin you're in. What else do you want me to say? Oh, just start with the things? Okay, cool. All right, so we're talking about nighttime skincare. So, you know, there's daytime skincare, nighttime skincare, and it's important to understand that the skin is doing different things both morning and night, and so you need to adjust your skincare routine for what's going on. So obviously during the day, it's all about protection from environment, so sunscreen, antioxidants, all about shielding your skin. In the wintertime, shielding it from cold, dry climates, things like that. But at night, it's really an important time to focus on your skin. What we understand now about skin at night is it used to be thought that the repair processes of the skin used to happen at night while you were sleeping. And but now we understand that it actually, the skin starts to go into repair mode once the day goes from sunlight, to sundown, basically. And so once the sun no longer sees your skin at night, that's when you want to do your nighttime skincare routine. So always kind of the thought was you would do your skincare routine right before bed. And yeah, you can still do that. The problem though is that your skin is already kind of starting to be in repair mode. So you want to create an environment in the skin where it can repair the best. But also some of you get a little lazy and tired and fall asleep on the couch. And the next thing you know, you're like, forget it, I'm not going to do it. So the benefit of doing your skincare routine earlier rather than later is that you're more likely to do it. So let's go into, yeah, I'll click to the next one. Let's go into what's important to do at night. So obviously wash your face. Now, let me say this, like there's so many estheticians that are like, oh my gosh, I had this client and she fell asleep with her makeup on and it was just like, the world was going to end. And yeah, it's not good to fall asleep with your makeup on and be lazy about your nighttime routine. But the reality is, once in a blue moon when you do that, it's not the end of the world. But you do want to create good habits and focus on getting off the day's grime and dirt and bacteria. We also understand, and some of you nurses will understand this, of course, is that we understand now that the face is actually one of the dirtiest places on the entire body, and it's because we're touching it all day long. Now, these days we have masks, but even so, taking off masks, putting it on, taking it off, putting it on, we're scratching our face. We have things under our nails that are getting on our face. We're itching, we're touching. People, don't even realize how much they're touching their face. So there's a lot of bacteria being transferred to the face. But also you secrete oil during the day. And so since oil breeds bacteria and bacteria leads to breakouts, you want to get that off the skin at night. You also don't want to skip using moisturizer at night. So a lot of times people think that, oh, I'm going to let my skin breathe. Well, all of you nurses know that your skin does not have a respiratory system. And so the concept of your skin breathing is false. Now people, when they say their skin breathing, they just mean kind of give it a break from makeup or whatever. But your skin cells really need water in order to be healthy. And after you wash your face, you always want to make sure you put moisturizer on to hold that water into the skin. So definitely don't skip. If you're looking to really kind of change your skin and create positive change and kind of jump on the preventative aging bandwagon, you might want to look into using a product with retinol. I'm sure a lot of you have heard about that. There's retinol, which is vitamin A, which is over the counter. I have one. I don't have it here, but it's in my line. But then there's also the prescription version, which is considered a retinoid. So a lot of people, and this goes back, I mean, it is so well studied that retinol and prescription retinoids are absolutely game changers for the skin, for smoothing, for building collagen, making pores look smaller, making lines and wrinkles look smaller. Like if other than sunscreen, because sunscreen is the most biologically active product on the planet, and so in theory, that's the most powerful preventative aging product, but number 2 is retinol or a prescription retinoid. It has so many years of scientific evidence showing that it really does resurface the skin, and if there is a fountain of youth, that's the closest thing to it. A lot of people will ask me, should I just go right to the prescription and use a retinoid, or should I just use a regular non-prescription retinol? And the answer generally is, if you're in your 20s or up to maybe 40, you can start using regular retinol, and you could probably just stay using retinol. But if you are 40 plus and you're new to it, you might want to start on a retinol, get your skin used to it, and then after about like 4 months or so, get a prescription for it, because over 40, you're really trying to reverse a lot of the aging that's already been done, versus somebody who's 25, they're kind of starting earlier. They're more about prevention. So definitely look into retinol or a prescription retinoid. And then also sleep with your head elevated to reduce eye puffiness. So a lot of people, I'm sure you guys are working really hard, not getting as much sleep as you would like. And a way to look more rested is to help with fluids draining well, and so prop up an extra pillow and you might be a little less puffy when you wake up in the morning.
Hey, Renee, we have a question I was going to ask you really quick. Andrea asked, is the skin repairing cycle the same for night shift workers? I spend so little time seeing the sun.
Right. Great question. So, I mean, generally, just when you think of your skin, when it is exposed to environment, it's in, it's in defense mode. And so basically when you are not exposed to environment, then your skin is not in that mode. And so, really what it is your skin's going to be better for it, because anytime you're exposed to environment, that's taxing on the skin. So if you don't really see daylight ever, then your skin's probably going to just be beautiful forever.
Awesome. That's one perk, I guess, of night shift.
Yeah.
Lysandra asked, is retinol safe for rosacea?
Great question. So the problem with retinol, particularly a prescription retinoid, is that they do have side effects. They basically break down the skin's protective barrier. And we know that with rosacea, your skin already has a compromised protective barrier. So part of a goal with whenever I see people with rosacea is we're doing certain things to the skin using certain ingredients within moisturizers, using certain really gentle products to try to build up that protective barrier. And so retinol and retinoids, particularly the prescription, as I said, is trying to break that down. So they do kind of, you can get some irritation more so if you have rosacea when you do use a prescription. So you probably would want to just stick with a regular non-prescription, because it's going to be gentler for you.
All right. Thank you for that.
Yeah, great questions. All right, so maskne. We've all kind of heard about maskne. So, I get so many messages and people having problems with wearing masks. And the challenge is that, and this is just with COVID, regardless even of masks, is the challenge is that anytime there's change, your skin can change. So all of a sudden what happened with COVID is, we're eating differently, we're hibernating more, we're, not wearing as much makeup, which could be a good thing, but again, it's a change. Some people are getting lazier about their routine because they're like, oh, well, I'm too tired, or, or I'm whatever, or I'm not wearing makeup, I'm not going to wash my face, why do I need it? Or, people could be eating differently. All of a sudden they're eating more comfort foods because they're, trying to comfort themselves from all the chaos. And then adding on top of it, you're adding a mask onto your face, and your face is kind of going, what's going on? So there's a lot of changes that I've seen with people's skin as it relates to what's going on with the pandemic. So the idea behind why masks cause acne is that you've got, and it's particularly in summer, but you've got, a moist environment from breathing added to summer heat. And anytime you increase heat in the skin, it triggers oil glands, especially if you are somebody that is more oily prone. And anytime you have more oil trying to push through the pores, it can lead to more breakouts. As I mentioned earlier, oil creates bacteria. Bacteria leads to breakouts, and so that's kind of what's happening. But then there's also the friction thing. You're talking, it's rubbing on the face. There's irritation from it. Also, some of the masks that you may be wearing are also pressing hard on the face, right? You take a mask off and you have like indents, and so anytime that you're pressing something on the skin, if you think of your pores as like little tubes, and the oil has to flow, the natural sebum has to flow. Even if you're someone who's not visibly oily, you still have kind of sebum flowing through the pores. And all of a sudden, when you have a mask on that's kind of squishing the skin, it can make a pore, the little tube that's normally straight, all of a sudden it can put a kink in it. And now all of a sudden the oil has a hard time getting out. So there's lots of different reasons why people are getting maskne. But the main thing that you really need to focus on is making sure you're washing and cleansing your skin at night or whenever you get off work. The best thing to do is, so when people are breaking out, they're like, oh my gosh, now I'm breaking out. How should I change up my routine? You want to make a tweak to your routine. You don't want to just all of a sudden ditch everything and all of a sudden start like switching to all these acne products. You just want to maybe introduce like one acne product. The best way I think to do it is switch to, ideally try to find one that's gentle. That's easier said than done, but a gentle like antibacterial cleanser I think is probably the best introduction you can do. the Renée Rouleau line. I have my own skincare line based on 9 skin types. You take a skin type quiz on my site, but we have this rapid response detox cleanser that has has antimicrobial properties to it, but it's also what's called sulfate free. So it's real gentle. It doesn't dry out the skin, but it really just does a nice like cleaning of the skin. And that's a good way to kind of get off all the daytime, bacteria and keep the skin clean without drying out the skin. You can also use an antibacterial toner during the day if you're kind of getting breakouts around the face area, or at night whenever you work. The nice thing about during the day is that if you are exposed to sunlight, you always want to wear sunscreen, but you're not getting sun underneath your mask. So you can kind of wipe something over the face and not worry that, if you wipe your sunscreen off, it's not a big deal because you have a mask on. So we have a companion toner called Rapid Response Detox Toner, and just maybe during a break you can take your mask off and just kind of wipe over the skin. And this is alcohol free. You don't want to dry out the skin, but something that again creates an environment in the skin where less bacteria is going to thrive. That's a really good way to do it. And then spot treat with acne spot treatments as needed. And I also, by the way, at my site, reneerouleau.com, I've had a blog since 2009. I have over 1,000 blog posts, all on skincare topics. So we do have a blog post specifically about maskne, and it would be great to read because it goes into a lot more depth. So if you go to my website, reneerouleau.com, click on blog, and you can read all 1,000 blog posts during your free time.
We have another question, Renee.
Yeah.
My understanding is retinol is inactivated by sunlight. When I was working long hours and having 4 hours sleep, I just skipped it. Should I apply it anyway, even though it's only for 4 to 5 hours?
Yes. So the idea is that products can get into the skin. A particular product with retinol depends on the delivery system, but it does engage your retinol receptors immediately. But then also, depending on the formula, if it's more of a slower delivery system, it can engage those retinol receptors for up to 8 hours. So it's more of a slow release. So it kind of just depends on the formula. But moral of the story is the majority of the work is being done within probably the first hour as it's absorbing into the skin. So yes, I would definitely get it on your skin, even if it's only on the skin for a short while. Great question.
Yeah, that is a good question. Thank you.
All right, so here are some just kind of general tips of things that my 30 year career as an esthetician has taught me. So one is I never use a bar of soap. So anything in a bar form, and again, these are just general tips, not necessarily related to nighttime or maskne, but anything in a bar form, the binders that hold a bar of soap together naturally have a high pH to them. And one of the most important things in your routine is what you wash with, because if you wash with something drying right out of the gate, now you've dehydrated the skin, you've stripped the skin, and then everything applied afterward, a serum, an alcohol-free toner, a moisturizer, has to do a repair work. So it's kind of like, they're kind of like canceling out. So definitely avoid anything in a bar form. Some people will go, oh, but it's Dove and it has a quarter moisturizer, or I buy this really exotic bar soap from France that has goat's milk in it and it's supposed to be really gentle, and all of that. But again, it's what makes it into a bar is what's drying. So I really suggest that people stay away from bar soap. Instead, look for what's called sulfate free, but you can do a foaming cleanser. But the general idea when you do use a foaming cleanser is look for something that lathers small. The smaller the bubbles, the less drying it is. The larger the bubbles, the more drying it is. So look for kind of small bubbles, and also feel your skin, right? Like if it feels super tight afterward, then that's never a good sign. But definitely using a gentle cleanser is the way to go. I'm also a big fan of toners, but you have to make sure they're alcohol free. So most companies, are really moving away from alcohol, like the astringent type toners. But so just make sure you don't want to dry out your skin. I mean, your skin cells are like fish; they need water to live, and it's important to keep water in the skin. But I do like using toners because when you wipe them over the skin and you leave them damp on the skin, and then you put on a serum or a moisturizer, it's like delivering 8 glasses of water right to your skin. It's super hydrating. It gives a lot of moisture. And then also avoid using sonic cleansing brushes. I don't know if you guys heard this recently, but There's a brand called Clarisonic, which is super popular, but they have officially closed their doors. So you will no longer, I mean, I'm sure they're probably still selling out their inventory, but rest in peace, Clarisonic skin brush. And part of it is, you know, it's L'Oreal owns it and they just kind of couldn't capitalize on it anymore. But also, you know, people were using it twice a day, which is what Clarisonic suggested. And you never want to put this brush over the face twice a day. That's like using a facial scrub twice a day. And people would never do that because they're like, oh, that's way too harsh. But somehow the cleansing brush, you know, was doing the same action. So I'm not a fan of those. Talking about heal a blemish fast. This is probably the biggest mistake that people make when it comes to blemishes is, as soon as you do get a breakouts from maskne, whatever, people will immediately spot treatment. They'll take, most spot treatments are drying, and they'll immediately, you know, put this on morning and night, whatever, to dry it out. Because you're all nurses, you understand the healing process of the skin. If you know, what happens with a blemish is when you get it, one of two things is going to happen, depending on the type of blemish, because not all blemishes are equal. It's either going to work its way to the surface of the skin and come out into a visible whitehead. That's considered a pustule. It goes through the papule stage first, but it will come out and, you know, come out into a visible whitehead. That's your body's way of saying, hey, I have bacteria in here, I have infection, this is how I want to heal myself, is to come out this way. Or if it's more of a cystic blemish, the hard sore knots under the skin, oftentimes hormonal in the chin and jawline area, but those stay as a hard sore bump, and then eventually your body reabsorbs it, right? So one of two things is going to happen. It's either going to come out or it's going to just go back down under. And the mistake that people make is when they use a drying spot treatment is that if it is a cyst, those hard sore bumps, that's not going to come out anyway. Now they're just drying out the surface of the skin, causing flakiness, drying out the surface for something that's never even going to hit the blemish underneath anyway. So then you just left your skin scaly and dry. Or if it is one that's going to come out, when you dry it out, you're causing layers and layers and layers of dry skin. And then this blemish, this whitehead, is trying to come out, and it's basically like you put a trap door there and it can't get out. So now this infection lingers in the skin longer. And when that happens, not only does the blemish last longer, but it also stretches the surrounding skin tissue and sets off an inflammation response, which leads to more pigmentation. So you know how when you get a blemish and you have the dark mark that lingers for a month or 2 months afterward, this is making that happen. And so the idea is, you know, I mean, I have 4 different spot treatments in my skincare line based on the life cycle of the blemish, and certain ones are used certain times. So it's kind of in sync with Mother Nature and the healing process, but not all lines have that. So generally speaking, you almost don't want to use spot treatments because oftentimes you're making it worse. So as much as possible, just let it run its course. And then if it does come to the surface, you can gently extract it to remove the visible whitehead. And then you can use the drying spot treatment that will close up the skin and help dry it out. I have a great blog post all on how to get rid of a blemish fast that talks about this more in detail. And then the last couple things here is really understanding your skin type. So when I became an esthetician, I went to school and we learned about dry, normal, and oily skin types. A lot of you as nurses, you're probably also familiar with the Fitzpatrick skin types, but that is more about skin tone. And so I learned all about that. But once I became an esthetician, I learned really quickly that, wait a minute, okay, dry, normal, and oily, sure, my client has dry skin, but guess what? She also has rosacea, and she's also getting some melasma, some brown spots. So what skin type is that? So I determined there were 9 different types of skin, and as I mentioned, ReneeRouleau.com has a skin type quiz that you can take to determine your skin type, and then it puts you into a curated skincare routine really based on the needs of your skin. But it's really important to, you know, especially for people who have a lot of different things going on, hormonal breakouts. I mean, like, kind of think about adult acne, right? You're like, okay, well, I'm 35 and I'm still breaking out, but guess what? I have wrinkles showing up. What's my skin type? Well, guess what? Renée Rouleau has a skin type for that. So really understand that your skin is unique. A couple things: dehydrated and dry are not the same. Dehydrated is lack of water. Dry is lack of oil. 2 totally different things. So you need to understand that, you know, using different moisturizers, some add water, some add oil, and understanding your skin that they're not the same and you may only need one versus the other. Focusing on all your needs, again, you know, just trying not to pigeonhole yourself into one generic type of skin will give you better results. And then lastly, understanding what sensitive skin is. So if I asked all of you, raise your hand if you have sensitive skin, probably 95% of you would raise your hand. But sensitivity is, everyone's definition of sensitive skin is something different. So somebody's is, oh, well, if I use products that are really harsh and drying, my skin will get really harsh and irritated. Okay, solution, don't use harsh and drying products, right? Done. So, but other people, you know, my definition, and then other people go, oh, my skin's really sensitive, I break out easily with blemishes. Well, that's not really sensitive skin, that just means you're acne prone, right? The true definition of sensitive skin is people whose, you know, things sting easily, you know, a rosacea type skin type, as we talked about earlier. You have a weakened skin barrier, little invisible cracks in your skin that cause irritation, a lot of redness and heat. You're somebody that, you know, after you are out of a hot shower, your skin stays red for an hour. It's just kind of that like overly active skin. I have a great blog post on this, but again, your skin is unique, and it's important to understand that not all sensitive skin types are, or skin conditions are equal. We have some other questions. Do we have time for a few more questions?
We do have a few questions, so we'll try to go through these pretty quickly.
Right.
Lauren asked, how long should I let my toner dry before using another product?
Don't let it dry, leave it damp, and then immediately put your next product on.
I did not know that, so that's great. Caroline asks, is skin purging a real thing when introducing new products to your skin, or does it mean you're having a bad reaction? How can you tell the difference?
That's a great question. So the short answer is go to my blog and type in the word purging, and I have a whole blog post on this. So that's the shortest answer. The next shortest answer is, great question. Typically, people will purge when they're using active products that exfoliate the skin and stimulate cell turnover, especially if your skin is not used to it. So it's not abnormal if somebody starts using a lactic acid or glycolic acid serum and they haven't been exfoliating the skin. You're removing kind of, you know, layers of trapped dead cells and retraining cell turnover. And so there could be some purging from some things that are clogged underneath. So yes, some purging is normal. Certainly with prescription retinoids, that's kind of retraining the skin, and there could be some purging. Again, read that blog post that will tell you what to do. But generally, if it lasts longer than, you know, 3-4 weeks, then it might be just not the right combination of products for you.
Okay, awesome. Sunny asked, what about Foreo? I'm not sure what this is, but I think it might be in regards to
a brush. Yeah. So I don't use any brushes because I just don't like that physical activity on the skin. Now I do use a facial scrub, but I only use it twice a week. I think Foreo and Clarisonic for that matter, they kind of are like facial scrubs. So Foreo just does it in a different way. But I still wouldn't use it after, you know, twice a day with every cleansing. I would think of any brush like that as a physical, which is considered a physical exfoliator, something just to use a couple times a week to lift off dead cells.
Okay, perfect. Another question is, do you have an opinion about what fabric of pillowcase to sleep on? She's read that silk may be better than cotton or polyester. Yeah,
so there is that school of thought that, you know, silk is better for wrinkles because your skin slides easier. I don't personally use a silk pillowcase. Now, what I do, which I think makes a much bigger difference, is I am aware of how I sleep on my pillow. So I think that's more important. They say that, like, aside from sun, the second cause of wrinkling is the way you sleep, because if you sleep on your side or something and then all of a sudden you're, you know, squishing the skin, it's like ironing wrinkles into your skin. So I think it's more better to focus on sleep position. If you go to my blog and type in the word sleep, you'll see all of my blog posts that talk about pillows and things like that. So, I mean, I think, you know, silk pillowcases, yeah, I think it could be beneficial. I don't use one. I mean, I don't think necessarily it's going to be a game changer, but I think I have no problem if people do it.
Okay. Another question from MC. I use St. Ives Apricot Blemish Control Scrub every morning and night. Is that bad? It's worked well for me for years. When I use a smoother one, my face explodes with acne.
Interesting. So the idea, which you may have heard this before, but St. Ives scrub, they basically take like, you know, apricot kernels, they grind it in tiny little pieces, but they can't control the edges. And so the idea is that you have these little microscopic, you know, small little rough edges on a facial scrub. And so when you massage it over the skin, you're creating little micro tears in the skin that can be disruptive and, you know, transfer bacteria because they're kind of cutting the skin. So I tend to hear more that people break out more from that versus using a facial scrub that has round beads in it, which is what I like jojoba beads. They're perfectly round and they roll across the skin. So, I mean, I would say, so I'm generally a fan of round-based scrubs, but I mean, if this is the experience that you're having, so just stick with what works.
All right. How do you approach acids and skin types and acne?
So generally, so like in the Renée Rouleau line, I have 4 different acid serums based on different skin types. The main acid that works best for acne is what's called salicylic acid, but it's also dependent on the percentage you use. So salicylic acid is oil soluble, which means it can get into the pore lining and it clears out the pore lining to keep pores clear, and it also exfoliates within the pore lining so that dead cells don't dump into the pore and cause the start of breakouts. Because again, going back to oil flow, when oil's flowing and if all of a sudden there's dead cells that are blocking within the pore, that's a breeding ground for breakouts. And so salicylic acid is the best. It just depends on the percentages. So like in the Renée Rouleau line, we have our BHA clarifying serum, which has a higher percentage of salicylic acid along with glycolic and lactic acid, because those both work also for acne. And then I have my pore and wrinkle perfecting serum, which also have the 3 acids, a little bit lower of the salicylic acid. So it really just depends on your skin type, how often you're getting breakouts. But generally using an acid serum, something with salicylic acid all over the face, will retrain the skin and breakouts should be less over time.
Okay, awesome. We have time for just one more.
Okay.
And I think we could all benefit from this one. What is your best tip for dark circles and under eye bags? As nurses, that's a huge issue.
Yeah, for sure. So I have lots of blog posts on this for sure. So the thing with, this is what you have to think about. When you wake up in the morning, you know, most of us are a little puffy under our eyes, or whenever you wake up, right? Your nurses, whenever that may be. But generally after you wake up, you'll have under eye puffiness from fluids and things like that. Also with yawning too, keep in mind that every time you yawn, that before you go to bed, that's creating fluids around the eyes that also stretch out the skin and cause puffiness. So that's another reason to try to go to bed early, so you'll have less yawning, so you'll have less puffiness. But so whenever you wake up, probably within about 4 hours, any puffiness that you have that is from sleep will go down. Anything that's left over after 4 hours, what's there throughout the rest of the day, that is what's considered a bag, right? Like that's not going anywhere. So unfortunately, surgery is really the best option. So like eye gels can help that morning puffiness and help some of that fluid retention go down faster. But again, you know, several hours later, whatever is left over is really just your skin. So, you know, cosmetic surgery to remove that, that loosened skin tissue is the best way. So if you're somebody that no matter what you do, you try every eye cream under the sun and you still have bags, it just means that, you know, that's just, it's how your skin is aging. But again, like sleeping with your head elevated, you know, for puffiness, trying not to eat a lot of sodium before bed is really important. And then for dark circles, yeah, no miracle there because a lot of it's genetics, some of it's allergies. Some people find good results with when you use an eye cream in your nighttime routine to massage it around the eyes because that can stimulate blood flow, which can maybe help some stagnant blood that leads to darkness. I also like to hang my head over the side of my bed at night for about 2 minutes to bring fresh blood flow to my face and oxygen, and that also helps with circulation to keep things moving. And then some people have good luck with under eye fillers. They can do like a little bit to kind of like create a little separation from the darkness underneath. And then lastly, invest in a really good concealer. Instant gratification concealer.
All right. Well, thank you so much for answering all those questions. That was a lot of really awesome information. I know I benefited from it myself.
Great, thanks.
All right, looks like we have Dr. James up next.
Super, super. Well, good evening, everybody. Thanks so much for having me on. Just a little bit about me. I'm the Assistant Dean of Research in the College of Nursing at Washington State University. My background is actually not in nursing, it's in psychology and criminal justice, but I have the pleasure of working with just some incredible people. And as a sleep scientist, I've always been extremely interested in shift working professional groups, and more have moved towards healthcare and towards studying nurses. A fun fact about me is that I am an equestrian, so I ride horses in my spare time. So this is a statistic that some people are aware of and some people aren't, and it can be quite shocking. If you've been awake for 24 hours, you'll essentially have an equivalent blood alcohol content of 0.1. So that means if you've been working a long shift, if you've been held over for overtime, and you've been awake for 24 hours and you're driving home, you are kind of above that legal limit where you're really quite unsafe to drive. So there's been a lot of focus around, you know, the potential patient care outcomes of fatigue, of nurse fatigue and working long hours and shift work. But there's also a really strong nurse safety component here. And we do know, unfortunately, from a scientific perspective, that drive home post shift is actually quite a dangerous time period for a nurse. So just in terms of a little bit of background, I'm sure that everybody here on this call has experienced being extremely tired and thinking, oh, I'm not sure if I should be driving right now. So like I said, the risks, there's safety, you know, one of the main ones, of course, increased risk to driving safety. There are performance risks of fatigue and shift work. So, you know, a number of studies now have found this connection between nurse fatigue and increases in preventable medical error, which of course is a very important and very significant problem in the country. There are also some really serious health risks to fatigue and to shift work. And the major ones that we see kind of categorized are cardiovascular, gastrointestinal, and metabolic. So if you're working shift, you know, and I'm not trying to scare anybody, but if you're a shift worker, it's really important to kind of prioritize getting enough sleep and taking care of yourself, because you're in this category, you're in this group where you're at increased risk for these concerns. And then wellness generally and quality of life, you know, we see some really strong connections between shift work and sleep-related fatigue with some mental illnesses, some family dysfunction, and so on. So that's essentially the background of why this is really important to, you know, to, like I said, to prioritize and to focus on. So kind of specific to the job and with nursing, we see that fatigue kind of leads to the reduced ability to deal with complex or stressful situations. And if you had to describe nursing in a sentence, you know, I think dealing with complex and potentially stressful situations is a fairly accurate way of doing so. Reduced attentiveness and understanding, so it really can impact that therapeutic relationship with your patients and how you can empathize and how you can relate, how well you advocate for your patients. Increased anxiety, irritability, and fearfulness are all associated with fatigue, and then impaired physical and cognitive functioning as well. Part of that is increased risk, for example, of lifting injury, you know, where we start to become a little bit less careful when we're tired about how we go about the elements of the job. So what can we do about it now that I've thoroughly terrified everybody? You know, holistic health and wellness, which of course is, you know, the only path to health and wellness, and is the reason why you're doing this fantastic series this week, in my mind, really starts with a foundation of good sleep. And I say that not just because I'm biased as a sleep scientist, but because stress management and nutrition and exercise, skincare, and all, you know, the wonderful aspects of self-care are not going to give you the effects that you really want. They're not going to do the most for you if you're not getting good quality sleep, because you're just not going to reap all that benefit. It's not going to do what you want it to. So how you go about promoting your sleep falls into a variety of different ways. The term sleep hygiene really just means creating the best possible sleep environment and making the most of your sleep opportunity. And some top tips in terms of sleep hygiene that I always like to impart are: one, it's important to have a cool, quiet, and dark sleep space. Now, I'm fully aware many people on the call are likely night shift workers, so this can be easier. This can be easier said than done. But I mean, at minimum, I mean, investing in a good pair of blackout blinds is really, really critical. You know, you're going to have to artificially create that dark environment. Quiet, again, of course, for shift workers can be difficult with kids and with, you know, roommates or whomever. It can be challenging. So you might need to artificially create that as well by finding some earplugs that you find comfortable and really workable. And then cool is another one. A lot of people don't know that a warmer sleeping environment, it can be quite effective at getting you to fall asleep, but it's not very good for maintaining good quality sleep. So always have your bedroom a couple of degrees colder than you think it should be, and then you can always add back with blankets if you need. So if you wake up and you're a bit cold. Light therapy is a very important one for sleep hygiene, and especially for shift workers if you're changing your schedule, right? So I mean, if you're going from when you're on duty, and if you're on days, let's say you're getting up really early, or you're night shift, so you're trying to sleep during the day, the light therapy, or this idea of exposing yourself to light when you want to wake up and avoiding light when you want to be sleepy and wind down, is a really effective way of kind of jump starting and kind of shifting, you know, shifting your biological clock, even just fractionally, which can help a little bit with coping with those changes. So light therapy, again, you know, I mean, obviously the sun is the best, but if that's not feasible, getting something like a light box, they've been marketed quite a bit for seasonal affective disorder, but they're very readily available, and having something like that beside you for kind of 20 to 30 minutes when you want to wake up. So let's say you're a night shift worker and you've come home in the morning and you've had as much sleep as you can, and you're, you know, awake during the day, and then hopefully, you know, maybe you get the chance to have another nap, and then you get up and you want to really gear yourself up for going on shift. That's an excellent time to get that exposure to that light. You don't have to stare directly into it, but just having it beside you is great. And then light avoidance, sunglasses is a good way of doing that. One caveat there, of course, is do be careful. Like if you're driving home, always prioritize your safety for driving over, you know, oh, I really don't want to get sunlight because I don't want to, you know, wake up too much and then struggle to fall asleep when I get home. You just have to balance that out a little bit. But let's say if you have a lift home, or, you know, you're really confident that you're not going to run into any driving difficulty, then eliminating or minimizing that light source can help you fall asleep when you get home. And establishing a bedtime routine. Of course, this might need to change based on where you're at in your work cycle. So, you know, that you can still establish a routine in terms of when you're on shift, this is the bedtime that I would like, this is the wake time that I would like. Quite an effective way of sleeping if you're a night shift nurse is to actually split your sleep. So like I said, get home, try and sleep for about 4 hours, be awake, and then try and, you know, get another 2-3 hour nap before you go back on shift. But try and keep that as consistent as you can. The next kind of major component to consider fatigue countermeasures, because unfortunately with shift work, no matter how good your sleep is, no matter how much you're sleeping, you're probably still going to experience some fatigue. So countermeasures are quite important. Use of caffeine, strategic use of caffeine is probably the best known countermeasure. Some things to consider there: be aware that it takes about half an hour to kick in. And try and avoid having caffeine too soon before you want to go to sleep, because it really will take about, it'll take about 6 hours or even more to kind of exit your system to the extent of getting good quality sleep. Strategic napping, Without question, napping is the most effective fatigue countermeasure because everything else is essentially a band-aid versus napping, which gives you what you need to not be tired, which of course is sleep. I say strategic napping. There are two main types of nap. One is a power nap, and that's about a 20-minute nap. And the reason for it being about 20 minutes is because when you sleep, you go through sleep cycles and different phases within that sleep cycle. And what you want to avoid, if you can, is going down into really deep sleep. Because if you wake up from that deep sleep, you'll get sleep inertia, which is that horribly groggy feeling where you think no job in the world is worth getting up right now. And you know, you really want to try and avoid that if you can. The other type of nap is kind of a longer, more restorative nap, and that's about 90 minutes. And the reason for that is because that will put you through pretty much through an entire sleep cycle, certainly hopefully have you back up to a light phase of sleep when you're waking up. Other fatigue countermeasures, use of melatonin is one. You do need to be a little bit careful with melatonin because the more you take it, the more your body will stop naturally producing the amount that you need. But it can be very effective if you're, let's say you're going from a series of days, if you're on a rotating schedule, you're going from a series of days to a series of nights. It can be a useful way, like I said, of kind of adjusting yourself in addition to that light therapy. Other fatigue countermeasures that are quite effective that I haven't put up here are hydration. Dehydration and fatigue are actually quite connected. So if you're tired, I always say try and have a glass of water, see if that helps. And then strategic use of exercise as well. Exercise raises your body temperature, so it's quite a nice way of giving yourself kind of an alerting boost. And try and avoid exercising right before you go to bed because your body temperature needs to be lower as you fall asleep. The other really important thing is self-monitoring. You know, you want to set sleep goals, and the only way that you're really going to know if you're meeting those is by monitoring yourself. So tracking your sleep in some way, whether that's through a device such as a Fitbit or you know, an Apple Watch or whatever device you might have. If you don't have one of those and you don't want one of those, that's no problem at all. You know, you can just keep even just a little diary, a little log of knowing how much sleep you're getting, and that way you can kind of hold yourself accountable. And really monitor your sleep debt and catch up. Sleep debt is what we call the phenomenon of if you consistently don't get enough sleep, at some point you're going to have to pay it back. It builds up and builds up. The good news is you don't have to pay it back exactly. So if I'm an 8-hour sleeper and one night I get 7 hours sleep, that doesn't mean the next night I have to get 9 hours sleep. You try and pay it back by about half. So the next night I would try and get 8.5 hours sleep. And that should kind of put me back relatively close to equilibrium. I don't have it up here, but the recommendations for the sleep recommendations are still between 7.5 and 9.5 hours per night. There are some individual differences, but the 4-hour night sleeper is extremely rare. And most likely, if you think you're getting by just fine with 4 hours, you're getting by at about 70 to 80% capacity. And that's going to increase your risk of problems in the long term.
We do have one question, if you can address this one, Lois. Are there any strategies you recommend for making sure we wake up or set our alarms for the ideal time in our sleep cycle?
Yeah, so one thing is know that a sleep cycle is kind of 90 to 100 minutes. So that's about the length of a sleep cycle. So if you know that you're going to fall asleep relatively quickly upon sleeping, just literally count those and factor them in, right? Because when you're sleeping, you're going to rotate from light sleep down to deep sleep or slow wave sleep into rapid eye movement or dream sleep, and then back up to light sleep. And you're going to rotate through those. And what you really want to avoid is waking up during that deep sleep period. So like I said, for napping, that's kind of a 20-minute or a 90-minute nap. But if you're doing a much longer sleep block, just kind of factor that in, right? So kind of like 3 hours, 4.5 hours, that kind of thing. And it's certainly not a guarantee, but it should hopefully just help you a little bit with that timing. There are some devices now, they've not been super validated, but some kind of like alarm clock type devices that claim to be able to kind of wake you up in that phase. But like I said, there's not been a ton of science behind them.
Great. One more question, then we can move on. I take a nap almost every day, and sometimes I'll set my alarm for 30 minutes and I'll wake up within 20 to 25 minutes feeling refreshed. Other times, if I know I need sleep, I'll set my alarm for an hour, but I wake up and don't feel too groggy. Is this normal? What are your thoughts on just not setting an alarm and letting your body determine when it wants to wake up?
Yeah, if you can do that, that's ideal, right? You know, so I mean, if you're getting off shift, I mean, that is honestly one of the best ways of doing it, is just let your body determine when you wake up. If you're setting an alarm for an hour and you're waking up and you don't feel particularly groggy, likely you've already come through your slow wave sleep and you're into a kind of maybe a bit of a dream sleep state. But for most of us, about an hour is actually not a very good length of time for a nap, because that usually is right at that point where we're still in deep sleep. But you know, I mean, sleep inertia is kind of a funny thing, and although we all experience it, some of us, I don't know, it just seem to be affected a little bit less, or seem to be bothered a little bit less by it, where some of us just find it really, really appalling. So my recommendation is always kind of the 20-minute or the 90-minute. But if you find, you know, one of the most important things with sleep is if you're happy with your sleep, that's fantastic. If you're happy with your routine and you feel like you're, you know, getting good quality sleep, then don't change anything. That's perfect. You know, if any of the things that I'm saying here today, you know, I mean, don't try them just for the sake of it. If you already feel like my sleep is really good.
Great. Thanks, Lois.
So just in terms of your checklist moving forward, like I said, kind of remember those important things with sleep hygiene, that cool, dark, and quiet sleep environment, that routine, other things in there that I haven't really spoken about. Limiting technology, of course, is a really important one that we're all horribly bad at. But, you know, at the very least, making sure that in your handheld devices that you activate like the shift worker mode or the night shift mode or whatever the mode is called, where at a certain point of the day, and you get to set that yourself, at a certain time, the light level emitted changes to a much warmer light, which is less alerting. But also, you know, we need to be careful that sometimes with social media and whatnot, we can get to kind of almost just like a scrolling kind of a zoned out state, which actually is not very good for inducing sleep. And one thing that I do hear a lot about is people will wake up in the middle of the night or wake up in the middle of their sleep phase and kind of check their phone and start doing that. And it's really not very good for good quality sleep. The fatigue countermeasures, we've kind of already gone over those. The caffeine, and one thing I will say about caffeine is make sure you really monitor your tolerance. It's not an exaggeration to say that many of us, if not most of us that drink coffee, probably do have somewhat of an addiction to caffeine. So just being careful, you know, if you're a shift worker, if you know your circadian low, the time where you're going to feel the worst is about in that 2 to 4 a.m. period. If you know that you're going to struggle then, try to make sure that you can have some coffee, or you can have some kind of alerting boost at about 1:30 in the morning or thereabouts, and don't kind of tank up in it earlier, so that when you get to that point, it's not going to have the effect that you need it to have. And then self-monitoring sleep, just really, really important for, like I said, for setting goals and holding yourself accountable. Thank you so much.
Any additional questions for Lois? I know there was a question about sleep debt. I tried to answer it. Hopefully I did it justice. Basically that once you said, if I only sleep, for example, 5 hours the next day, do I have to quote pay or add the hours that I didn't sleep the day before or not? And what I mentioned in the chat was, if I'm paraphrasing correctly, you do need to pay it back, but not in full the next day. You can take it bit by bit.
Yeah, and oftentimes, you know, with night shift work, for example, it can be extremely difficult to get 8 hours of sleep per 24-hour period, even if you're splitting sleep, even if you're adding naps. It can be extremely challenging to do that. So then, you know, I mean, if you know that that's going to be the case, make sure during your consolidated time off that you're really trying to like sleep saturate or get, you know, the longest possible amount of sleep that you can, because that really, you know, can like I said, bring you back to that equilibrium, bring you back to baseline. The thing that we see so much is, you know, and I understand why, you know, you on your consolidated time off and you want to see your friends and you want to visit with your family and you want to do all of the things that you can't do during that on-duty period. So sleep kind of gets pushed by the wayside. It's not prioritized and it's not considered to be important. And the one thing that thankfully I don't hear it as much as I used to, but this feeling of, well, I'll sleep when I'm dead, you know, and it's horribly ironic because not sleeping really can take years and years off your life. So, you know, it's very, very important to remember that it's not an afterthought. If you want to be healthy, if you want to be well, if you want to do well, if you want to perform well, if you want to be the best possible version of you, getting the sleep that you need isn't an option. It's an essential.
Absolutely. Any other questions for Lois? I'm about to start night shift. I have heard of night shift nurses using Benadryl to assist in quick sleep before heading back to work the same night. Any advice on how to wind down quicker with only 12 hours off?
Sure. I'm not a huge fan. I mean, I know that a lot of people think it's extremely effective, and I'm sure that, you know, to a degree it is. I'm not a big fan of using either using sleep meds or using medication where sleepiness is like a side effect. You know, if you look at some of the sleep disorders, like if you look at insomnia, for example, I'm sure that everybody's aware of what insomnia is, either difficulty falling asleep or difficulty staying asleep. The use of drugs, whether they're specific sleep meds or kind of others, like I said, that have sleepiness as a side effect, they're extremely ineffective for working in the long term, right? So, you know, what I would always recommend there instead is finding some kind of cognitive behavioral approach, you know, finding whether it's meditation, whether it's belly breathing, like box breathing, breathe in for 4, hold for 4, breathe out for 4, hold for 4, whatever your version of counting sheep is that actually works, find that, because it is going to be much more effective in the long term. And with shift work, unfortunately, it's one of those things that you're going to have to, you know, whether you believe in meditation or not, you know, whether you believe in mindfulness or not, you're going to have to start really understanding some ways of switching yourself off. And so I would always advise that. And also, of course, with the caveat there that although I am a sleep scientist, I'm not a sleep doctor. So I'm not in a position to kind of really talk all that much about sleep meds outside of saying, you know, if you're really concerned, speak with a sleep physician.
Excellent. Well, that should wrap it up for today. Again, thank you all for coming. Thank you, Renee. Thank you, Lois. It was wonderful information. And thank you to our friends at Outdoor Voices.